Hi everybody, it's Amanda Ridout with Health and Homeopathy, and I want to talk to you a little bit about what homeopathy is. So, at some point in your life, you've probably walked down an aisle of a health food store and seen a row of small stacked blue bottles with exotic names. There's also these little purple bottles, and the name homeopathy on their labels. So seeing them in a health food store leads some people to think that homeopathic remedies are just another form of herbal medicine, but actually they're not related at all to herbal medicines, and instead they're used in a unique and very popular system of medicine called homeopathy. So what is homeopathy exactly? Well, we are now learning that homeopathy is a form of nanomedicine. Homeopathy is an effective and scientific system of healing which assists the natural tendencies of the body to heal itself. It recognizes that all symptoms of ill health are expressions of disharmony within the whole person, and that it is the patient who needs treatment, not the disease. As a new patient, these ideas may be new to you, but homeopathy has been established for about 200 years. In 1796, a German doctor, Samuel Hahnemann, discovered a different approach to the cure of the sick, which he called homeopathy, from the Greek words meaning similar suffering. Like Hippocrates, 2,000 years earlier, he realized that there were two ways of treating ill health: the way of opposites and the way of similars. So take, for example, a case of insomnia. The way of opposites, conventional medicine or allopathy, is to treat this by giving a drug to bring on an artificial sleep. This frequently involves the use of large or regular doses of drugs, which can sometimes cause side effects or addiction, and of course are toxic to the human body. The way of similars, the homeopathic way, is to give the patient a minute dose of a substance, such as coffee, which in large doses causes sleeplessness in a healthy person. This will enable the patient to sleep naturally. Homeopathic remedies, properly prescribed, are safe and can be given to pregnant women, babies, and children, and even the elderly. This is because only a very minute amount of the active ingredient is used in a specially prepared form. Your homeopath will give you a homeopathic medicine or remedy which matches your symptoms as you experience them. This also takes account of you as a person, your individual characteristics, emotionally as well as physically. So how does it work? Homeopathic remedies work by stimulating the body's own healing power. This stimulus will assist your own system to clear itself of any expressions of imbalance. The aim is to get you to a level of health so that eventually you will need infrequent treatment. So as a homeopath, I need to know all about you. A detailed understanding of who you are, along with any complaints and details of how you experience them, is needed to assess your case correctly. So anything you can tell your homeopath that is typical of who you are will help this process. Finding out about your general energy level, your past medical history, the way you live are also important. Anything you say will be treated in the strictest confidence. The initial consult may last an hour or more. What will the treatment be like? Your homeopath will give you a homeopathic remedy, usually in the form of pellets or a tablet, which should be allowed to dissolve in your mouth. Or you may be given a liquid remedy with instructions. Nothing else should be put in the mouth for 5 to 10 minutes before or after taking the tablets, not even toothpaste or cigarettes. Your homeopath will usually advise you to avoid peppermint and preparations containing menthol, eucalyptus, and camphor. These can interfere with the action of the homeopathic remedy. If you are taking a homeopathic remedy and feel that you need to take additional medication, conventional or homeopathic medicine, consult with your homeopath to discuss how this might affect your homeopathic treatment. If you develop a cold, a headache, or any symptoms that concern you, please discuss them with your homeopath. What will happen once the treatment starts? After taking your remedy, you may notice some changes. Some patients experience a period of exceptional well-being and optimism. Sometimes your symptoms can appear to get worse for a short time. This is a good sign that the remedy is taking effect. Sometimes a cold, a rash, or some form of discharge may appear as a spring cleaning effect, which means your system is going through a cleaning stage. Old symptoms can reappear, usually for a short period of time. These symptoms will pass and must not be treated, as they are a very important part of the healing process. If any response of your treatment concerns you, contact your homeopath as soon as you can. It's important to know what happens as treatment progresses. You might also want to take notes of any changes and then take them with you to your next appointment or discuss them on your next phone call or on your next video chat. How long does treatment take? This depends very much on what sort of illness you have, as well as other individual characteristics of your case. So it's not realistic for your homeopath to assess this until it can be seen how you respond to the remedies prescribed over some time. It is possible to say that a slowly developing complaint, or one that has been experienced for some years, will not disappear immediately, although there may be a response and some improvement quite soon. Other acute complaints may get better more quickly. Homeopathy cures from the inside, and often outer symptoms such as skin complaints are the last ones to clear. So be patient. In the long term, it's much better for you to be cured of both the cause of your illness and its symptoms, rather than just merely relieving or suppressing the symptoms. Remember, every case is different and no two patients are alike. A homeopath will ask you about your usual diet and lifestyle and may suggest changes, especially if it seems that this is contributing to your illness. Of course, a good basic diet is necessary for good health. Less sugar, alcohol, and refined foods. And we've come to see that a well-nutrified body is a body that responds better to the healing process. There is an increasing awareness of the benefits of foods free from artificial colorings, preservatives, and flavorings. Whole foods and organic foods free from chemical pesticides and fertilizers are also increasingly available, as well as amazing supplements like the Mighty 90, plant-derived minerals, and so much more. We do recommend that you maintain your relationship with your general practitioner if you have one. Your GP will be able to arrange any tests or x-rays you may need. Homeopathy has an alternative philosophy, but by working in this way with your GP, the two systems of healthcare can provide complementary services. So you may be wondering if you can treat yourself with homeopathic remedies, and the answer is yes, you can. You can use remedies at home to treat first aid problems such as cuts, stings, minor burns, bruises, fevers. There are a number of good books available out there. A couple that I like are A Guide to Homeopathic Remedies, another one, A Complete Guide to Home Treatment. Another one would be The Complete Homeopathy Handbook. So that's pretty much what you can expect from a homeopathic consult. If you would like to know more or schedule your consult with me, you can email me at awridout, that is awridout @gmail.com. Thank you for watching, and if you liked this video, please share with those around you. Click the like button and subscribe to my channel. Stay tuned for the next health video coming soon. I need a gin, which is one of these, not gin.